Today I'm going to be demonstrating the oxygen flow for a non-rebreathing system. Again, just like with the rebreathing, we'll start with the oxygen tanks at 2000 psi, and they go through the oxygen reducing valve at 50 psi, where it then comes to our oxygen drop lines, and then we connect our anesthetic machine as previously shown, and then it comes to our flow meter or oxygen flush as previously described with the rebreathing video. Now, after it comes to our flow meter, we have it coming out the tube and then coming through here to our vaporizer inlet. From there, once the vaporizer is turned on, it will then go through the vaporizer, pick up whatever the desired percentage is, and then it will come to the vaporizer outlet. Now the difference is that this outlet was made for the fresh gas flow to go to the rebreathing system, where you have the unidirectional valves and you have the CO2 canister. Keep in mind, we do not use those with the non-rebreathing system. So what we have to do is disconnect this from the vaporizer outlet, and we have, for this machine, we have a different fresh gas flow for the non-rebreathing. And again, they can only fit into one side. So we now have a different hose that's used for the fresh gas flow. Now, for this machine, we have this called the non-rebreathing adapter, or the Bain adapter. And what it does is it just slides, see this square rectangle? It slides right on to this part of the machine. Okay? What you need to keep in mind is now we're using a different part of the anesthesia machine. So you'll notice there's a new scavenger adapter. There's a new pop-off valve. So what we need to do is remove the scavenger from the rebreathing portion and attach it now to our non-rebreathing portion. Very important to get rid of those waste gases. Now, our fresh gas flow with our new adapter here needs to be able to get the oxygen and the isoflurane to our non-rebreathing circuit. What you need to do is push this onto the little green adapter nozzle. Please note that you need to hold this little nozzle firmly with your 2 fingers and gently place and slide or twist this clear hose onto it. If you push it too far, or when you take it off, if you're not holding it with your fingers securely, you could end up pulling this whole tube out and damaging the circuit, which would mean you would need to replace it. Now, from there, I also need to replace my reservoir bag. So I'm going to take my reservoir bag from the area where it was for the rebreathing system and change it over to my non-rebreathing adapter. So I have my reservoir bag, I have a new pressure manometer, a new pop-off, my new scavenge attached to that pop-off valve. I have my fresh gas flow coming in to my non-rebreathing circuit. Now, the oxygen and isoflurane are going to come in through this inner green hose and go all the way to the end to where it's attached to my patient's endotracheal tube. When the patient inhales, they will take those gases in, and then when they exhale, the exhaled gases will go through the outer hose and go back this way. Similar as being described with the rebreathing system, the exhaled gases will take the path of least resistance. So with the oxygen and isoflurane constantly coming in the inner green hose, the exhaled breath can't push against that. So the exhaled gases will take the path of least resistance and go through the outer hose. All the way back here and it will either go to the reservoir bag or out the scavenge. Now, the question that often occurs is, well, how do the patients not rebreathe their exhaled gases if they're going into the reservoir bag? It's a very good question. The reason that does not happen is because with the non-rebreathing systems, we require a much higher oxygen flow rate. So the oxygen flow rate for the rebreathing system is much lower, and the non-rebreathing system is close to 200 mils per kilo per minute. It's almost 4 times higher than the other type of system. And the reason for that is that we do not have the CO2 canister and granules to absorb those exhaled breath, the CO2 from the exhaled breaths. So each time the patient exhales, they'll have an exhaled breath, and then another exhaled breath, and each exhaled breath gets pushed further and further away from the patient. But in order to get it away faster from the patient so they do not rebreathe those exhaled gases, we have that really high oxygen flow coming in through the inner green hose, and it will really fast push those exhaled gases away, and it'll push them into the reservoir bag and out the scavenge. And because those flow rates are so high, it goes really fast in the reservoir bag as well, and it ends up diluting out those exhaled breaths. So whatever ends up being pushed back to the patient is almost negligible. From there, if it doesn't go to the reservoir bag, it will go out the scavenge and away with your scavenge system. Keep in mind, your pop-off is always open. That is the oxygen flow for the non-rebreathing system on this type of a machine. We do have another type of machine that is a little bit different. So this machine over here, you'll see looks much different than the one that we just demonstrated. What you'll need to do is, you can see here that there's a dial. You can have circle, so rebreathing, or Bain, which is non-rebreathing. You want to ensure that you turn the dial to whichever type of circuit that you're going to use. Please note that the pop-off valve is right here, as is where you would hook up your scavenge hose. This machine is harder to follow the fresh gas flow because a lot of it is underneath within the anesthetic machine itself. What you need to do is take this Bain circuit. I'm going to remove this fresh gas flow hose for this machine, and now set up this machine. So I have my reservoir bag that fits here. I have my Bain or non-rebreathing circuit that fits there, and the hose for it, for the fresh gas flow to connect, is this one right here that hangs down on the side of the machine. So I'm going to firmly hold the nozzle. I'm going to gently twist that clear hose on. So now I have my fresh gas flow being connected to my Bain circuit. Same idea. I will have my oxygen flow meter. It will bring the oxygen to the vaporizer inlet, through my vaporizer, out my vaporizer outlet, and then down this hose, which leads to the inside of this machine. Now this machine, we cannot see where those hoses go to, and we rely on the turn of the dial to be for the appropriate setting. When it is on circle, it will do the rebreathing portion with the unidirectional valves and the CO2 canister. For this circuit, we are doing non-rebreathing, the Bain, so we will turn the dial to Bain. We have our fresh gas flow hose hooked up, and now the fresh gas flow will come up here. It will go to our patient, as it did with the other one, through the inner green hose, and then back out the clear hose. And then it will either go to the reservoir bag or out the scavenge. And that is the oxygen flow for a non-rebreathing system.